Have you ever been told you need a diabetes test and your mind just started racing? Yeah, you are definitely not alone. So today, we're going to break it all down step by step so you know exactly what's going on and, more importantly, why it matters.
Okay, so let's just dive right in. At its heart, diabetes is all about how your body uses glucose. And glucose is just the sciencey term for blood sugar, which is basically the fuel that runs our entire body. Think of it like the gas in your car's engine. So how does that fuel actually get from the bloodstream, the fuel line, into your cells where it's needed? Well, that's where a hormone called insulin comes into play. It's like a tiny key that unlocks your cells to let all that good energy in. But with diabetes, there's a hiccup in this whole process. Either your body isn't making enough keys, or the locks on the cells are kind of jammed and don't work right. Now, to really get what these tests are even looking for, we first got to understand the different ways this condition can show up. You've got a few main types. In type 1, the body pretty much stops making insulin altogether. Then there's type 2, which is way more common. That's when the body's cells just aren't responding to insulin like they should. You can also have gestational diabetes, which happens during pregnancy. And then there's prediabetes. Honestly, just think of that as the check engine light on your car's dashboard. It's a warning that your blood sugar is high, but not quite in the diabetes zone. So why would a doctor even bring up getting a test? Like, what are the triggers? It pretty much comes down to two main things. You're either noticing some symptoms or you have certain risk factors. Yeah, when your body is having a hard time managing its fuel, it starts to send out some pretty loud signals. You might feel like you're thirsty all the time, or you're running to the bathroom constantly, feeling totally wiped out, being super hungry, or even noticing your vision is a bit blurry. These can all be signs that your blood sugar levels are just off.
But here's the thing, and this is super important. Sometimes there aren't any obvious symptoms, especially in the early stages. And that's exactly why doctors look at risk factors. Things like your age, whether it runs in your family, your weight, and how often you get moving can all play a part. It makes checking in on things early a really, really smart idea.
All right, let's get down to the nitty-gritty. You're at the doctor's office. They say you need a test. What happens now? Let's walk through the tests themselves so there are absolutely no surprises.
Okay, first things first. I know a lot of people worry about this part, right? Needles. But the great news is these are really simple, totally routine blood tests. There's almost no risk. You might feel a tiny pinch and maybe get a little bruise later, but it's temporary and fades super quick. It's really no big deal. So there are basically four main tests your doctor might talk about. The A1C test is awesome because it gives you the big picture, your average blood sugar over the last 3 months or so, and you don't even have to fast for it. The fasting and random tests are more like a quick snapshot in time. Then there's the OGTT, which is a bit more involved. Think of it as a stress test to see how your body handles a big dose of sugar.
So that OGT test sounds complicated, but I promise it's not. Let's break it down. First, you'll come in after not eating overnight, and they'll take a blood sample. Simple. Then you drink this specific, kind of sweet drink. And finally, you just hang out for a couple of hours, and they'll take one more blood sample to see how well your body dealt with all that sugar. That's it.
All right, the test is over, you've got the results back. This is the moment, right? So let's talk about the big question. What in the world do these numbers actually mean? Your results are going to put you in one of a few buckets. The first one is healthy. Your glucose is right where it should be. The second is prediabetes. That's our check engine light again. Your levels are high, and it's a warning sign. And the third bucket is a diabetes diagnosis. This just means your blood sugar is consistently high, and it's time to team up with your doctor and make a game plan. And this leads to what might be the most important point of all. Getting a result, whether it's prediabetes or diabetes, is not the finish line. Nope, it's the starting line. It's the beginning of a new chapter where you get to be in the driver's seat. If you do get a prediabetes or type 2 diagnosis, the amazing thing is how much power you have. Lifestyle changes, even small ones, like adjusting your diet, moving your body a little more, managing your weight, can have a huge, huge impact. For real, sometimes these changes are enough to manage it, or heck, even reverse it. Now, for type 1, the game plan is a little different. Remember, the problem here isn't that the body is ignoring insulin, it's that it's not making it. So managing it is all about replacing what's missing, which means keeping a close eye on your glucose and taking insulin to keep everything balanced. And what about gestational diabetes? Well, for most moms, the good news is it usually clears up right after the baby arrives. But think of it as a little heads up from your body. It does mean you're at a higher risk for type 2 down the road, so just keeping up with future check-ins is a great idea.
Look, at the end of the day, all of this, it's just about giving yourself the power of knowledge. It lets you have smarter talks with your doctor, understand your own body, and take charge of your health. So really, the question isn't just about what the test says, it's about what you decide to do next. What will your first step be?